It gives me great pleasure to introduce Dr. Roxanna Gapstur, who in January this past year came to York and joined WellSpan as our new President and Chief Executive Officer. Roxanna brings over 25 years of healthcare experience working in a variety of settings, including group practice, academic, and integrated healthcare systems, which included health plan operations. Prior to her appointment here at WellSpan, she served as a Senior Vice President and President within the Health Partner System, which is based in Bloomington, Minnesota. See, I said Minnesota. Dr. Gapstur has extensive experience in strategic planning, business development, and operational leadership in both the ambulatory and hospital settings. She served in multiple executive roles, including Chief Operating Officer, Chief Nursing Officer, and as a senior executive accountable for population health. Roxanna holds a bachelor's degree from the College of St. Catherine in St. Paul, Minnesota, and her master's and doctorate degrees from the University of Minnesota. So to my fellow Penn Staters, there is a Big Ten connection there. She was named the top 35 women in healthcare leader by Minnesota Women's Health Leadership Trust in 2014. She's also participated as a member and president of various nonprofit boards, including the Greater Twin Cities United Way, Minnesota chapter of the National Hemophilia Foundation, and the Minnesota Organization of Leaders in Nursing. Fellow Rotarians, please join me in welcoming Dr. Roxanna Gapstur.
Good afternoon. It's delightful to be here. I'd like to thank Rick for the introduction and also for the Rotary Club for hosting today. This is lovely. Being a new resident in York, I learn something new almost every day. And today I learned that this is the 25th largest Rotary Club. So that's really awesome. That's amazing. I think it also fits in with what I've noticed about this community, which is really service above self. So I congratulate you for having such a great community and such a close-knit community. So today I get to talk about WellSpan, which is one of my favorite topics. And so I just want to start out by saying, January was my first month here, so the past almost 5 months now, I've been leading WellSpan Health. And you probably know that on November 1st, we had a new partner join our organization, and that we are now 19,000 team members strong. We have about 1,500 employed physicians in our medical group and advanced practice clinicians, 8 respected hospitals, a regional behavioral health organization, and a visiting nurses association as well. Already, just having been here for a few months, I think it would be an understatement to say that I'm proud of WellSpan and our legacy of service to communities, as well as our care delivery leadership across central Pennsylvania. Upon my arrival here, I could easily discern that the WellSpan team strives for excellence each and every day. I've been impressed by a proud yet humble culture where teamwork and compassion for our patients and families leads the way each and every day. Perhaps most conspicuous, though, among my early observations has been this passion for collaboration that I've noticed between WellSpan and its communities. It's really noticeable across all 5 counties, and of course here in York, where it all started, I've noticed it the most. It includes long-standing partnerships with many community organizations, as well as relationships with some of the finest academic health centers in the world, Johns Hopkins and Penn State, to name a couple. For almost 140 years, WellSpan Health and York Hospital have served the needs of this community in some of the most challenging health circumstances. I'm confident that most of you probably know our organization pretty well, and I'm grateful for the trust that you've placed in WellSpan. But I'm hoping today to share a few things with you that might surprise you about our organization, and I think with an outsider's eyes, it will also give a little bit of a different flavor. So first of all, WellSpan's been a national leader in making healthcare easier to find, access, and use. And having been here your whole lives, some of you probably don't realize that the Apple Hill campus was actually one of the very first ambulatory medical campuses in the United States. Now that was back in the late 1980s. So people from all over the United States actually came to see the Apple Hill Medical Campus as a real innovation. And as you know, it's still there today and has now really become an innovative medical mall with many different services on the campus. And we could list many. So we've got outpatient surgery there. We have a surgery and rehabilitation hospital. We have diagnostic imaging and a women's center, cancer care, and other services. On average, 2,000 patients and families come back and forth on and off that campus each and every day of the year. Over the years, WellSpan's leadership in ambulatory care has led to a vast network of more than 170 care locations across our 5 counties. That's a lot. And so this tradition of thought leadership and innovation is one that WellSpan can be very proud of. Just a couple of words about the Apple Hill campus and some of the things that are happening there now. Some of you may know that we're expanding our cancer center on the Apple Hill campus. It'll be a 62,000 square foot expansion, and it will allow us to provide screening, infusion therapy, medical and radiation oncology, as well as surgical services in a larger and more modern facility. In York County, we know that there are 2,000 cancer cases diagnosed each year, and that we expect cancer cases by 2022 in our county to rise another 8%. We think having an expanded cancer center is a critically important part of the care that we provide. And we'll be able to provide social, therapeutic, and ancillary services at the center as well, so that our patients really receive all of their care in one location. And what's more, we're going to be adding extensive care navigation to the cancer care experience, so that our patients, through the whole journey, will have someone that walks right along beside them to guide their way. Our relationship with the Johns Hopkins Kimmel Cancer Center is an important part of our program, as you might know. And there are 2 things that we rely on Johns Hopkins for. One of those is a really direct line for second opinions, which can be very important to some of our patients. And the second is the extension of research and clinical trials into our community, which is a really important part of cancer care these days. We think the power of our Johns Hopkins relationship with our expert physicians and a newer, more modern facility is really going to make the cancer center journey easier for our patients and families. Secondly, the Apple Hill campus is going to be home to a brand new advanced heart and vascular center. This will bring the offices of our honestly world-renowned cardiologists here. I have to say that a couple of times during this speech, because we are so fortunate to have the cardiology care that we have in our community. Those cardiologists, as well as our cardiac and vascular surgeons, will have their homes in this building, and it will include our preventive, diagnostic, and rehabilitative cardiac services all in one location. We expect to break ground on this building in June, and it will be finished in September of 2020. Many of you are aware that we have a commitment to making healthcare easier to access for the residents of the Hanover area as well. And we've opened a new urgent care center there, as well as a new family medicine practice in Spring Grove. And of course, our new WellSpan Health and Surgery Center, which opened on Baltimore Street in March. And I'm not sure if you heard, but our open house there was one of the largest we've ever had, with over 1,200 community members. So we could see that the community was really excited about the Hanover Surgery Center. That's an 80,000 square foot facility that includes 36 exam rooms for our specialists, 4 operating rooms, and 4 procedural rooms, where our surgeons and proceduralists are offering state-of-the-art procedures. Here in York, we're excited to bring some additional services to the western part of our county. So we have a new specialty center opening up in West York, as well as an expansion of our family medicine practice on Roosevelt Avenue, and a new urgent care clinic that just opened a couple of months ago. These are all really good things for our community. Now, aside from providing great physical access at WellSpan, we're trying to make healthcare easier to use. And I think we could all agree that that's a good thing. So using technology has now become a very important part of the care that we provide. And we recognize that a lot of tasks of daily living people are now performing with a swipe of their iPhone or a click of a mouse. So WellSpan's building a digital care experience for our patients and families. And you'll notice that the My WellSpan app that's up on the screen there, very easy to use, by the way. I use it. I am not a great techie person. More than 174,000 of our patients have signed up and enrolled in My WellSpan. There are a number of things that you can do on the app, from refilling a prescription to communicating with your physician to actually scheduling online appointments, which I just did last month. And I can attest that it's extremely easy to do. And so more than 17,000 appointments now every month at WellSpan are scheduled right on the app. Our employees right now at WellSpan have access to online urgent care, and it's been so successful that we are going to be expanding that now in the next few months to all of our patients and families. This will allow anyone who has an acute injury or condition, if they would like to just be right from their home with their iPad or computer, to be able to have a doctor's visit right then and there, and that's what our employees have been enjoying for the last year or so. We're also exploring digital care in other ways. Through some of our primary care offices, we offer video visits, which allow another way to access care. And some of the more unique care that we're offering right now with technology includes an application called Baby Scripts. So for women with low-risk pregnancies, if you sign up for Baby Scripts, you can actually receive some remote monitoring through the application, and you can communicate with your care team by turning in those remote monitoring things like blood pressure and weight. You can actually forego about 5 of your prenatal visits by using the application. So you'll see on the screen that we've had more than 2,700 women sign up for that, and we've prevented more than 980 in-person visits, so people are able to stay at work or at home instead of going to the doctor. Recently, our radiation oncology application just won an award from the American Community Cancer Center Association, and that was really leveraging technology in cancer care. This is very unique. This application was actually developed by our own teams at WellSpan. And this is another application that allows communication with the physician, as well as reporting of symptoms through the application. What that allows for then is for the care team to understand what's happening more quickly and to look for serious symptoms and hopefully prevent an ER visit or a hospitalization. So these are just a few of the examples of some of the digital care that we have available now and the ways that at WellSpan we're trying to transform the patient experience. If I continue on the innovation and transformation theme, you might also be a little surprised to learn about our reputation in complex care across the region. Perhaps you caught a recent news story about our radiologists who are now using artificial intelligence with our imaging to diagnose and identify prostate cancer earlier than we otherwise could. We know that when prostate cancer is diagnosed earlier, the cure rate goes from 30% to 90%. Our radiologists are extremely excited about this application. You probably read that if you read any of the articles or saw the news. We expect that we're the only ones right now in New York County that are using this new technology. I'm sure others will follow, but we're excited to be leaders in that area. Another example of our leadership is in quality. You may have heard or seen in the paper about the sepsis work that WellSpan York Hospital and our other hospitals have done. Sepsis is a life-threatening infection that can actually kill people who come in too late to the hospital. What we've done is actually provide remote monitoring for our patients in the hospital where signs and symptoms can be picked up much earlier. And it creates an opportunity for our team to intervene right at that moment in time. What we've seen in results over the past year and a half is that our mortality rates at all of our hospitals are now in the top 10% in the nation, and that other hospitals and care organizations are calling us to find out how we did that. It means that 250 patients walked out of our doors last year who would not have. Pretty impressive work. Keeping my voice going here so Rick doesn't have to do the rest. So continuing on with advanced specialty care, I know that many of you are aware we're a level 1 trauma center. We treat more than 2,000 serious trauma cases each year, that we have the only level 3 neonatal intensive care unit in York County, where we treat 475 critically ill newborns each year. In addition to that, another program that we're very, very proud of is our comprehensive stroke program at York Hospital. This is a program where we treat the sickest stroke patients that anyone can treat. It is the absolute highest level of treatment. And I would say that one thing you should know is that only 3% of U.S. hospitals are comprehensive stroke centers, and we have one right here in our community where we treat more than 1,100 strokes each year. Secondly, I mentioned earlier about our world-renowned cardiologists. We have a cardiology team at York Hospital that's honestly second to none. Last year, we triaged 10,000 patients with chest pain and treated over 700 who'd had heart attacks. We are expanding our cardiac catheterization labs this year to provide that team with additional state-of-the-art technology to make care even safer and outcomes even better. I think it's no secret to anyone in this room that WellSpan Health has a few new competitors in the market. We have tremendous respect for the large Pittsburgh-based organization that has joined our market. But we think that we have bigger challenges, actually, in our community. And those include the pressing health concerns of all of our friends and neighbors, including chronic diseases, obesity, mental health issues, housing insecurity, and last but not least, the opioid epidemic. In addition, the rising cost of healthcare has made care unaffordable for too many. We all know that what happens at the doctor's office or the hospital is only a part of improving health. The larger majority of health influences occur outside of those doors. Things like the foods that we eat, things like smoking, food insecurity. As we strive to make York County a healthier place to live and work, I've been really impressed with WellSpan's leadership in something that we're now calling social determinants of health. And I can think of two really great examples of where we're leading. The first is housing insecurity. Together with community partners, our care teams at York Hospital and in our care management area are creating better ways to serve patients who could potentially be medically discharged from the hospital but have no safe place to go. By collaborating with a host of partner agencies and local government officials in York County, these partnership projects are helping to place patients in appropriate housing for continued care and recovery toward better health. In fact, these efforts have now resulted in statewide recognition from the Hospital and Health System Association of Pennsylvania. And this year, WellSpan Health will be receiving the Living the Vision Award, which is the highest award that the Health System Association awards to any organization each year. The award is given to recognize the single best effort across the entire state to improve quality, value, and outcomes for our community's most critical needs. We're so proud of our teams. A sincere thanks to our community partners who've worked with us on those programs for their tireless work and efforts. Many of them are represented here today. A second example on social determinants of health, where WellSpan is really leading, is in the opioid epidemic. You may not know that WellSpan York Hospital was one of the very first hospitals in the region to start the Warm Handoff program. This is a program where patients are able to be transferred directly from the emergency department into treatment for opioid addiction. That's what the Warm Handoff part is about. In 2018, we touched more than 160 patients with the Warm Handoff program. This approach to opioid addiction treatment is saving lives, and we're very proud to have been the first to start that program. On the community front, many of you may know WellSpan physician Matt Howley. Matt's a leader in our York County partnership efforts, and he serves as the director of the York Opioid Collaborative, as well as the York City Bureau of Health. So regardless of the health concern, social determinants of health don't happen alone, and WellSpan will continue to partner with those community organizations who have a deep-seated need to assist with supporting the health of our community in the similar fashion that we do. So, what does the future of healthcare look like? Well, I suppose the answer to that probably depends on whom you ask. But at WellSpan, we've been thinking really critically about this for the past 5 years or so. And we have a vision of healthcare that allows WellSpan to create an ecosystem to improve health. And there's a few things that we think about with that. Number one, we envision a not too distant future where healthcare is really at your fingertips, where, when, and how you want to access it. We envision even deeper relationships with our community partners to take on the myriad social determinants of health that are adversely affecting our community. And third, we envision a world where healthcare is more affordable for those who need it. Now, we would acknowledge that a future with those characteristics is a big challenge for all of us. Simply put, we will need to reimagine the way we provide healthcare to our communities. I know that affordability is probably on the minds of many of you in this room, and I won't suggest we have a silver bullet to solve this national problem. However, this is an area that we are thinking deeply about. We have a few things that we're working on, and I'd like to share a little bit about what we've done with our own employees too. We'd like to help patients receive the care that they need in the best setting at the right time. We'd like to address financial barriers by offering greater price transparency to our patients and families. We'd like to reduce waste and inefficiency in healthcare, something that we work on every day, and improve our processes such as management of pharmacy benefits, as well as work more closely with payers on innovative solutions to affordability. And so one example of this is our recently announced partnership with Capital Blue Cross. Together, we're going to work on coordinating a future where the financing and delivery of care are integrated in a way that allow efficiency and overall better experiences for our patients. We see great benefit in working together with organizations that share our commitment to transforming healthcare. And while the issue of affordability in healthcare is complex, our objective is simple, and that is to control the cost of care and pass those savings on to our patients and communities. We've realized quite a bit of success with our own employees, and I really want to give a lot of credit to the population health team at WellSpan, as well as all of the departments that are interdependently working with that team. What we have seen is a much lower rise in costs with our employees than you would guess would be a national average. And a lot of that work has been done right inside our own organization. We think that using the lessons that we've learned with our own workforce, as well as some leading practices from other markets, will help us become more innovative and able to transform the experience. I'd just like to leave you with this thought. So I am not from York. I didn't know that much about WellSpan before I came here. I've learned a lot in the last 5 months. And I will say that this community is extremely lucky to have a health system with the characteristics and the services that WellSpan Health has. It's a great health system, and we're always working on being better. I think the transformation that's taking place inside of our organization is one that's going to lead to better health and affordability for our communities in the future. And I'm sure that my colleagues here who are with me today, and I thank them all for coming, would agree that there's been no more exciting time to be part of WellSpan than right now. So I appreciate the positive relationship WellSpan has had with many of you. We look forward to partnering with you in the future. And I want you to know that I'll be doing everything I can to support the health of the York community. Thank you so much for having me here today, and thanks for placing your trust in WellSpan Health. Thank you. Questions if anybody has one. Yes?
I was surprised to learn about the volume of translation services that we're providing face-to-face, the number of hours, and the different languages. That's impressive. Can you speak to that?
Yeah, I don't know the exact statistics, but I have heard them since I've been at WellSpan. I don't know, Maria, if you want to answer. The question is, what are the volume of translation services that we have at WellSpan? It's pretty extensive. We have many languages. We provide thousands of interpretive hours every year, and that seems to be growing. Is there anything you'd add?
No, I would just say say maybe that it is a part of our commitment to equity and disparities in our community, and we have been building increased capabilities as our communities have culturally shifted.
That's right. Yep. So building increased capabilities in that interpreter area. Thank you for that question. No other questions? Oh, yeah.
I just read this week that about 70% of America's young people are not eligible to serve in the military, one of the reasons being obesity. And I was curious as to what programs WellSpan has or might consider to help the obesity epidemic locally here.
So the question is about obesity and how there's a lot of young men and women who can't get into the military because of obesity. It's something that we've noticed actually in our own employee population too, as an area of focus. We have in the past had weight management programs at WellSpan. We're actually in discussions right now about what might be the best approach with our own employees, and then something that we could roll out to our patients and families. I think it's a really important issue for our organization and for our community. It seems to be on the rise. Yeah.
You talk about the affordability side of things.
Yep.
Where do you see right now as the most inefficient parts of healthcare that can have an impact on the affordability going forward?
Yeah, so I think some of the things I talked about around digital technology. So the question is, what are the most inefficient parts of healthcare? Maybe I should have you guys tell me. You know, what we're seeing is that there are often visits or things that can be done in other ways. So that, as you know, in the past it was you have a visit and we get paid for the visit. You have a visit and we get paid for the visit. That's been the old model of reimbursement. By working together with our health plans, like our partnership with Capital Blue Cross, we'll be able to offer alternatives to face-to-face visits, and that will be economically feasible for us. Whereas right now in a fee-for-service system, it isn't. It will also save employers money. It will save patients and families time running back to the doctor. And we've seen such great success with our Baby Scripts app that we're very excited about that opportunity. So I think that's probably one of the bigger ways. I see more hands.
You mentioned technology. Well, technology is unaffordable by so many people that need the most medical care, whether it be minorities that are, and an understanding of how to use technology, whether it be older people. What is WellSpan doing in reference to that? It's great to go technology, but if it's not enhancing people that need it the most.
That's a great question. She's asking about what about people who can't afford technology? Well, one of the benefits of having these partnerships between health systems and payers is that there's often an advantage to us to be able to give technology to people who don't have it and to be able to monitor remotely. And so that is something, if you look across the United States at Kaiser or Intermountain or even Geisinger, some of the larger health plan care delivery organizations, they provide a lot of those things to their patients and families. So we'll be looking towards some of those solutions. I think there was another hand. Yeah.
Will your relationship with Capital Blue Cross affect your relationship with other organizations like Geisinger?
Yeah, good question. So will our relationship with Capital affect our relationship with other organizations? I know it won't. We've been in close contact with all of our partners. We will be working with all of our health plan partners as we always have. We do have a special relationship with Geisinger, and that will continue. Yes. Good. Thumbs up. I guess that was the right answer. So. Other questions? Yes.
So what's WellSpan doing to address the chronically long ER room waits, which I've experienced many times within the last year? It's really bad. There's also seems to be a major shortage of beds and being able to get admitted because there's nowhere to put you.
Yeah, absolutely. I might let Keith take that one. I can give you a little high level. Well aware about the ER waits and the shortage of beds. Gosh, it's something we're dealing with every day, and I should say mostly Keith is dealing with every day. So we have a number of different things going on in our organization to try and work on that. And we have seen some results, and maybe you haven't noticed it yet, but we are slowly improving in some areas on that. It's a really big challenge because with the ER expansion for York Hospital, we projected some volumes for that expansion, And by the second year after the expansion, we had already hit the volumes that we had projected for 5 years out. So it's a really big challenge for the teams that work at York Hospital. And I don't know if you want to add anything else, Keith, about the consulting.
My chief nursing and chief operating officer's here, so I feel like I should let her answer. Your boss was so gracious about me. But I think Roxanna hit on it. When we did the original projections for the use of the emergency department 3 years prior, we were at about 70,000 visits. We're going to hit about 90,000 visits right now. So a lot of the opportunity in the emergency department is to do as Roxanna said, is to get lower cost alternatives available for our patients so they don't need to use the emergency department for primary care services. The majority of folks that are waiting in the emergency department are those with lower acuity conditions. I tell people all the time that if you want to get seen right away, just tell folks you have chest pain. We'll get you right back. You don't like what we do to you. We'll get you right back. So this is a long-term, this is a long-term issue, and it's multifactorial. And I think the benefit of being part of the health system like WellSpan is it's not just the hospital that has to deal with it. We can partner with all of the different agencies within the organization. So I appreciate your patience. I promise you it is probably the biggest issue on our plate right now. And we will get better for you. But thank you for your continued support of the emergency department because they do give good care. The wait times is the area that I think we have.
Yeah, absolutely. Thanks, Keith. It looks like there is one more.
Just to go off of that, do you guys invest any money in marketing to customers to go to your urgent care centers versus going to the emergency room? I know for us, I work for Penways. It's one of the largest issues that we have with our employees is encouraging them to go see PCP or go to urgent care versus going to the emergency room.
Yes, we absolutely do. And we've been opening new urgent cares throughout our different markets. So you've probably seen that. We just opened one a couple months ago, and we have another one that's, I'm going to say right off 83 that's under construction. Is that right? Yeah. See, I got my roads right. This is good, you guys. Yeah, so absolutely. And if you look across WellSpan, even on our screensavers on our computers, we have ads for urgent care and things encouraging our employees to go there. Keith?
Just to say one thing, I appreciate you bringing that up. There's a law called Impala. that as soon as somebody enters the emergency department, we are not allowed to redirect them outside. So you all can help with that. If you can help inform your patients to use some of the alternative care sites, that will help us. But if they show up, we cannot release them until they are treated and stable. So that's a wonderful point.
I think one thing you can definitely do better is evaluate the acuity of the people coming in. To me, that seems to be, and I've experienced this twice in the last 4 months with my wife, who's had complete bowel obstruction 2 times. And I don't feel that they did a good job of evaluating the acuity of her pain, her condition, what was happening, other than the minimum taking vitals and things like that. So that would be one suggestion that I would have is there's got to be a better way of evaluating people as they're coming in, because there were people that were getting seen with much less acuity issues within my wife. So.
Well, I appreciate the comment. Yeah, you and I can connect with.
Sure.
Great. Yeah.